Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
But we are going to be talking about the Heartburn Center and what goes on here at the Heartburn Center at Fairfield Medical Center. You remember several months ago, gosh, time goes so quickly, it might even been almost a year ago now, when the Heartburn Center was just getting geared up. We were here and talked with some folks, and we're going to kind of get an update today and find out what's going on and how the Heartburn Center can help you. We have three guests today. My first guest is Dr. Elwood Martin. I know you have a very busy schedule, so we'll get you out of here as quickly as we can. But tell me a little bit about your role here at Fairfield Medical Center.
Well, in general, I'm a general surgeon here at the hospital. I am the medical director of the Heartburn Center, which opened a year ago, January actually. And then beyond that, I am the chairman of the Department of Surgery here for Fairfield Medical Center, and I'm involved in a practice with three other surgeons. Serve on a lot of different boards and committees, as do most of the surgeons and physicians here at the hospital. I'm
always interested when I talk to newer doctors in our community to find out what attracted you to Fairfield Medical Center.
Well, that's an interesting question, and it was kind of a series of unintended events that got me here. I knew that I was getting close to being ready to leave the situation in Minnesota, and I actually called a friend of mine here in Columbus who practices at Riverside to kind of get some advice, and he had just had dinner with one of my partners who had informed him that they were looking for a new partner, so it was kind of by happenstance that I got connected with Dr. David Hassel, who also trained where I trained at, and that's kind of started the ball rolling, and one thing led to another. My family's from this area, my wife's family's from this area, so it was an easy fit and decision.
Well, tell me a little bit more specifically about what you do in connection with the Heartburn Center.
Well, the Heartburn Center, first off, is a name that was given to what we're doing here that makes it easy for the community to understand what we're trying to address, but it's really so much more than that. It really would be better named a diagnostic and treatment center for esophageal disease. We are at this center currently using the latest technology to evaluate the esophagus for its function and to evaluate the esophagus and stomach for evidence of reflux disease, gastric acid exposure to the esophagus. What we do here is we offer comprehensive evaluation and treatment of the esophagus and esophageal disease. Our nurse coordinator, which is Tina Cass, does a phenomenal job of running the program at its foundation in terms of funneling patients into the system and then getting them appropriately referred to physicians for their evaluation and treatment. Our goal here is to make sure that every patient that presents to our center has a thorough and complete evaluation of their esophagus and stomach to determine if they have reflux disease, if they have a motility problem in the esophagus, and if so, how to best treat that problem. It's quite interesting because a study was recently done that looked at how effective community physicians were at making the diagnosis of reflux disease based on the patient's complaints and on how well they responded to a medication that is used to treat that disease. And the study essentially came down to this. Of the patients that responded to medications and were presumed to have reflux disease, 50% in fact did not have reflux disease.
Really?
Of the patients that didn't respond to medications and were presumed not to have reflux disease, 50% had reflux disease. The moral of that story is that it's not a disease that can be diagnosed based on symptoms in response to medications. Thus, the center, to help identify who those patients are and make sure they get appropriate treatment, and equally important to make sure that those patients who do not have reflux disease are not unnecessarily placed on medications that have their own sets of potential side effects and complications.
I can certainly understand it from that aspect. None of us wants to be taking medication that we don't need. But from the other aspect, I mean, how big a problem is reflux disease? I mean, everybody has heartburn, right?
Well, in fact, that is a very accurate statement. I think essentially 100% of people who have not had previous surgery to adjust their anatomy will reflux. The question is, do they have clinically significant reflux disease? Is it enough reflux, enough acid exposure to cause problems? We know that reflux disease is the underlying cause of esophageal cancer, specifically adenocarcinoma of the esophagus. We also know that the vast majority of people with reflux disease will not, in fact, get esophageal cancer. We have some means of identifying who's at risk. It's a precursor lesion called Barrett's esophagus, and we have the capacity to identify that through the things that we do here at the center. We also know that about 30% of Americans have clinically significant reflux disease. Identifying those patients, providing them with a full diagnostic evaluation to, number one, determine if they're candidates for surgery, and number two, for those who do not want surgery or who are not candidates, to fine-tune their treatment so that their symptoms are adequately managed. That's what the role of the center is. And it's also to educate patients to understand that this is not just a disease of inconvenience. It is a disease with potential significant consequences. Not only the disease itself, but the treatments that go along with it have complications and consequences that they need to understand more fully.
What percentage would you say of the patients are able to manage their symptoms with treatment as opposed to having to have surgery?
I think the vast majority of patients will get some symptom control. It really depends in part on what the patient's expectations are up front, as well as what specific symptoms they have. Regurgitation, which is a very common problem, is not going to be controlled with medications. That is a problem where they're feeling the sense of stuff in their stomach coming up into their esophagus and back of their throat. That is not a symptom which is generally well controlled with medications. On the other hand, heartburn often is very well controlled. Atypical chest pain, which is something we see a lot of here, there's mixed results in terms of medication management versus other types of treatment. So it's going to depend upon what their primary complaint or symptom is and what their expectation is. Medical management is not intended to completely relieve symptoms. It is intended to get those symptoms to a place where the patient can function and have reasonable quality of life. Now, the other thing that's, I think, equally important to understand when it comes to medical management is that patients often ask me in my office, if I decide I want to do medical management, does that mean I can never have surgery? And the answer to that is no. At any point in time in their care, if they decide I've had enough of the medical management and I want to be considered for surgery, we can walk them through that process and determine if they're a good surgical candidate for the treatment of their disease.
We're talking with Dr. Elwood Martin, who is the medical director of the Fairfield Medical Center Heartburn Center, and we're going to continue our discussion about what goes on here at the Heartburn Center after this break. Dr. Martin, thank you so much for taking time to talk with us today.
My pleasure.
We'll be right back. Welcome back to Fairfield Today, coming to you today from the Fairfield Medical Center Heartburn Center. If you were with us in the first half of the program when we were talking with Dr. Elwood Martin, you heard him mention Tina Cass, who is the nurse coordinator of the Heartburn Center. And we've kind of joked here before the program, and Dr. Martin reemphasized what a great job that Tina does. She takes out her magic wand and makes everybody better. Tina, thanks. It's great to have you back with us again today. Remind us about your role as the nurse navigator here.
Okay. As a nurse coordinator, I meet with patients in my office. I provide education, which is free. So there's no worry about insurance coverages or referrals or anything. Patients can just call me, get an appointment. I do education with them. If they want to have an evaluation with a physician, I help them get that connection with a physician and an appointment, and then follow them throughout their course.
How busy are you?
We're very busy. We've been very busy this past year. It's been just a little over a year. We've been open, and for a combination of testing and one-on-one education with me, we've seen over 500 people.
That is a lot of people in a year.
Yeah.
When we talked before, we talked a little bit about this partnership with the Legato Medical System. Can you remind us what that's all about?
Sure. It's a really nice collaboration that we have with Legato Medical System. It is a physician in North Carolina who has started heartburn centers across the country. And basically he comes in, he is a second opinion with our physicians, and he does their education about the testing that we do, because as Dr. Martin mentioned, we do have state-of-the-art testing. So they've all had training with Dr. Dangler from Legato, and so he is a resource to them if they have one along the way that's been a little difficult to diagnose or treat. He is someone that we can contact and immediate response back, and they can communicate. And sometimes he's even referred them on to a nationally known physician. We've had conferences one-on-one. He's got us connected with all kinds of people across the country who really specialize in reflux disease and esophageal disorders.
Well, I can't imagine that there are resources that aren't available here at FMC, but it sounds like if we should come across something, there is a network that we can pick those resources up.
Exactly.
Have we made a lot of use of the Legato system since we opened here?
Oh yeah, I mean, Dr. Dangler's also done a lot of training for me and helping me learn so much more about reflux disease than I ever thought I would know. And it's so interesting, and he and I have conversation quite routinely. If I have a question, he's just a phone call away, and they also help with a little bit of our marketing, give us ideas and so forth, but they're a good connection for us to have.
What are some of the symptoms of reflux disease?
Well, some common symptoms of reflux disease, of course, is heartburn. That's why we're the Heartburn Center. But it's also regurgitation, where it feels like they can feel the acid coming up in their throat. Chest pain, some swallowing difficulties. There's other less common symptoms, although I meet people all the time with these symptoms. Cough. They've gone and had all kind of pulmonology tests and can't find anything going on with their lungs, but we do some reflux testing and find that reflux is associated directly with their cough. So that's what's causing their cough symptoms. Dental problems from the acid coming up on their teeth all the time. Nighttime symptoms. There's all kind of research being done about how it impacts the productivity of someone at work the next day because they have such a terrible night's sleep from their reflux symptoms.
Well, it sounds like that there are a number of things that, if we're experiencing them, we might be passing off as something else.
Exactly.
And continuing to treat with over-the-counter medication or whatever,
Yep.
and just not having any
Right.
success.
Right.
You have had success with a lot of patients.
Yes, we have.
And we're going to talk with one of those
Okay.
patients when we come back. But Tina, thank you for taking time to talk with us today. I'll let you get back to those 500 patients. I know how
Thank
busy
you.
you are. We're going to take a quick break. Stay with us. Welcome back to Fairfield Today. Kathy Bittler with you from Fairfield Medical Center's Heartburn Center today. We're broadcasting from the North Waiting area here at the Heartburn Center. And if you are just joining us, just to kind of bring it up to date, the Heartburn Center here at Fairfield Medical Center has been open a little over a year and seen about 500 patients. And we are talking now with one of those patients, and a patient with which I understand the Heartburn Center has had great success. Devon Marshall is joining us. Hi, Devon.
Hello.
Devon works here at Fairfield Medical Center. He's a graphic artist. What's that mean at Fairfield Medical Center?
Well, I am the graphic artist here at Fairfield Medical Center. What I do is I help paint a good picture of the hospital within the community. I use such items such as brochures. One of our most popular items which you have seen in the community would be the Monitor magazine, as well as any type of outdoor materials, inner marketing materials throughout the hospitals that you may see in our elevators and such.
How long have you been here at Fairfield Medical?
I've been here at Fairfield Medical Center for a good 4 years just about.
Wow, that's great.
Yes. Originally from Los Angeles, California, where I studied graphic design at the Art Institute of Los Angeles.
Well, how'd you end up here from LA?
I have a huge family. a huge family, many children, and it was just very ideal for me to move us here because of the property value. My money stretched a lot further here.
It would.
Yes.
Well, we're happy that you're here, and over the last 4 years, we've seen a lot of good work come out of the graphic art department at Fairfield Medical Center, and I know that you're hugely responsible for that, so thank you. I would imagine your job keeps you very busy.
Yes, it does.
A little bit of stress.
Yes, just a little bit.
So what made
But it's good stress.
So what made you think you might need to see somebody here at the Heartburn Center?
Well, I've been struggling with this, what I thought was probably gas or asthma. I also had asthma as a young child, and I thought perhaps I was just having an asthma attack or some sort of episode for many, many years. It's only in the recent years that it progressed. And it got a lot worse to where it kept me up at night. If I ate a late meal, I wasn't able to sleep well in the evening. I had to sit up perhaps in a chair or a lounge chair or recliner. I spent many nights in our recliner, and it made me a little cranky in the morning.
I can imagine.
Because I didn't get much sleep and I wasn't very creative the next day.
So it really was impacting your work, as Tina said was possible.
Yes, definitely.
What kind of symptoms were you having?
Well, there is the regurgitation that comes up, problems swallowing just a bit. There's I don't want to be too graphic, but there's a feel of chunkiness within my throat area, as if my food isn't digesting properly. As embarrassing as it may sound, yes, bad breath is definitely one of the symptoms. Also, feeling of having to vomit quite a bit was also a problem.
So all of these things then led you to check out what was happening here on the first floor, or did somebody say, "Hey, Devon, you've been writing about this stuff.
Well,
you got to go check it out"?
Yes, actually, we were marketing our Heartburn Center, and it was my responsibility to create a brochure for that. So I'm reading over the material that was supplied to me by Tina Cass, and I'm reading over the symptoms and thinking to myself, who in the world has all the symptoms? Because everyone listed I had. So maybe it's time for me to go get seen. It was a free consultation, and I figured, well, what do I have to lose? I have everything to gain.
Let's talk about that process. So you made an appointment, you sat down with Tina, what happened?
Tina was very, very informative. Explained to me all of my options and all of the symptoms, and then kind of used that as a measurement, as a guide. To help see what was best for me, whether it be surgery or whether it be medication. From there, I was referred to a physician, primary physician, Dr. Mara, and from there was then referred to a surgeon, which was Dr. Coley. Both Dr. Coley, Dr. Mara, and of course, Tina Cass explained to me my options, and based on the information that I provided for them, what I was going through on a daily basis, it was decided that it would be beneficial for me to use the medication versus the surgery. So it's their diagnosis was very tailored to the individual versus just saying, oh, you need surgery, oh, you need medication. No, it's very, very tailored to the individual's needs based on the symptoms that they're having at the time.
Did you attempt any lifestyle changes first, or were you beyond that?
There's always lifestyle changes. You get on that roller coaster of, okay, I'm going to begin my New Year's resolution and begin my workout schedule and things. I always seem to fall off the horse about a month after.
I think that makes you normal.
Yes. But definitely lifestyle changes. One of the things I would like to mention is the use of milk. I love dairy products. I am an ice cream fanatic, and I love me some ice cream. I love milk, and I had found that when I was having those symptoms, if I just drink a glass of milk, that it would soothe me and it would go away. What I did not know was that that was only temporary. That is false. Milk, those dairy products are actually a trigger and causes additional reflux. So I was actually doing more harm than good.
So it's not a license to hit up the Dairy Queen every day.
No, it's not. No, it's not. No, it's not.
Well, so how long ago did you go through this process? How long have you been on medication?
I've been on medication for the past 3 to 4 months.
And that doesn't seem like very long to me. Have you noticed a change?
I've noticed a tremendous difference. I know that the symptoms are still there, and once you have GERD, I mean, you typically it's something that you have to live with if you do not get your surgery, if you're just using medication. But the symptoms have been reduced significantly. I can sleep better at night. I no longer have the chunkiness in my throat, no more vomiting feelings. Well, I would like to think I no longer have bad breath.
You have to wait for your coworkers to tell you that?
Yes,
right?
yes. But I feel 100% better. Yes, I do.
If someone is experiencing the kinds of symptoms that you experienced, or even something on the lesser end, they haven't gotten to the point where you were, what would you say to them about coming here and about the process, and what kind of recommendations would you give them?
Well, that's a no-brainer. Definitely come and see Tina Kaz. Take advantage of the free consultation. Explain to them your symptoms. It is definitely something that you want to take care of. Esophageal GERD can lead to esophageal cancer, and that's something you do not want. So if it can be prevented, take the opportunity to and go and get seen, explain your symptoms, and hopefully everything will turn out wonderful for you as it did me.
Let's give that phone number here at the Heartburn Center a couple of times. 687-6486 and 689-6486. Okay, 689-6486 is that phone number. And I want to key in on a word that Devon has used a couple of times and that Tina used once, and that's a very important word in great big capital letters: free.
Yes. Yes, it is.
The phone call is free. The consultation is free. So if you're experiencing any of these symptoms, call that number. Come in here and see. Again,
it's a win-win.
Absolutely. Could be nothing. Could be something that with some very simple lifestyle change, your symptoms can be relieved. Or it could be something that has you on the road to something very dangerous like esophageal cancer. And that's why we call this the Heartburn Center, because it's too difficult to say the gastroesophageal reflux disease 4 times fast. But if you're experiencing these symptoms, 689-6486, call, come in, have your free consultation, find out how you can improve your life by a simple visit here to the Heartburn Center. Devon, congratulations. I'm glad you're doing better, and thanks for taking time to talk with us today.
Thank you.
That's all the time we have today here at Fairfield Medical Center and Fairfield Today, but we'll see you again next month.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fair Hope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, and Lancaster Fairfield Community Action Recycling and Litter Prevention.